This November, when you go to the ballot box, you'll have to decide on something called Issue 2.
And there have been a lot of ads out there about it already, but maybe you've seen this one. But do you really know what it is? Anchor Kristen Hartman explains.
Issue 2 targets the cost of pharmaceuticals, and it comes to you, the Ohio voter, at a time when headlines are calling drug companies and their pricing into question. Who could forget Pharma Bro, Martin Shkreli, who went to court over pill costs? Then there's the $600 EpiPen. This is the climate in which you're making a decision on Issue 2. Are pill prices pinching you? Skyrocketing drug costs have been the stuff of headlines. So when you tell someone there's an issue on the ballot targeting how much meds cost,
sounds pretty good. I mean, I wouldn't say no to that.
I wouldn't be in opposition to that at all.
But what about the details? And that's really what this issue is. It's emotion versus details.
University of Cincinnati political science professor David Niven
I'm perfectly willing to, stand in the middle.
helped us take a closer look at Issue 2, also known as the Drug Price Relief Act. For this story, my goal was to answer two primary questions for you. First, would Issue 2 lower drug prices for everyone? Your answer is right in the ballot wording. Issue 2 would, quote, require the state of Ohio to not pay more for prescription drugs than the price paid by the U.S. Department of Veterans Affairs, which gets a discount. When you decode that, the key is the state of Ohio. So while Matt Borges of Ohio Taxpayers for Lower Drug Prices tells you
it's time for us to enact our own reform that will bring drug prices down for everyday Ohioans.
The typical Ohioan's pharmaceutical bill would not be touched directly by this proposal. It's only those whose health care is provided for by the state.
the Ohio Department of Medicaid falls under that umbrella. Private plans do not. Still, Borges says if Issue 2 passes, it immediately
Covers 4 million people, 167,000 children.
Which means that 2/3 of our population are left out. Because 7 million Ohioans, that's 2 out of every 3 of us, don't get our drugs through state programs.
Dale Butland is with Ohioans against Issue 2.
And when you hear the other side say, oh, this would be $400 million in savings, it is simply not true.
Which brings us to our second question. Since Issue 2 calls on the state to get a 24% discount, what the VA gets, how much would it save taxpayers? Backers have projected a range, but in our interview, Borges said Ohioans would see
$400 million more in our budget to do things like fund schools, fight this opioid crisis.
True or false? Can you say that?
I'm going to need a third option on that true-false question, don't know, because nobody really knows the absolute bottom line.
Because we don't know exactly what the VA pays, and because drug pricing in general is murky at best. We are not done with our breakdown of Issue 2. At 7 tonight, we take a closer look at what the opposition is saying, and you can find a detailed FAQ about Issue 2 right now on WCPO.com.